there is often, usually about 90% of sore throats come from a viral origin, exposure to some sort of virus in a susceptible person. So that's most of the time when you're getting a sore throat, we're talking about a viral illness, which typically come on pretty quickly, and as long as the immune system is working well, will leave just as quickly. So oftentimes with a viral sore throat, there's no need for homeopathic intervention because the immune system is going to recognize what's going on. There's going to be a period of symptoms where the immune system is acting and clearing that virus, and then the individual is going to be restored to normal health in a fairly quick manner. So the other 10% of sore throats are going to be mostly coming from bacteria. And bacterial sore throats are a little more complex to deal with, usually a little more serious. So we're going to talk a little bit about some of those bacterial sore throats, particularly strep pharyngitis or strep throat, and how that needs to be managed. So some of the main symptoms you'll see with sore throats are going to be obviously soreness in the throat. You may be able to look at the throat and the tonsils and see redness. You may see exudate on the tonsils or discharge on the tonsils. In more serious cases, there actually may be ulceration or opening up of the tissue. Some accompanying symptoms that come with it are fevers oftentimes, obviously. Cervical chain swelling of the lymph nodes called lymphadenopathy. There can often be a cough with a sore throat, congestion of the sinuses. There can be production coming out of the chest, production and congestion in the chest. These are some of the most common symptoms, and of course accompanying chills, achy joints, kind of the symptoms of, again, the body's immune system really acting and tuning up, and fever being one of those major ways the body kind of gets amped up to fight something. In terms of what really you need to look out for when a sore throat is happening and the types of conditions you really need to be concerned about, the biggest one that comes to mind, and this is because it's very, very common, is strep throat. Most of us have probably had strep throat sometime in our life, and it's a very common ailment. Some people get it on an annual basis. It goes through schools, and it's pretty contagious. So it comes from a bacteria called Streptococcus group A beta hemolytic strep. And so the reason strep throat is so important to pay attention to and its manifestations is that the strep bacteria itself can migrate to different organs of the body. You've heard of something like scarlet fever, rheumatic heart disease, or glomerulonephritis or from strep. These are kidney infections. They all can be precipitated secondarily from a strep infection. And these are very significant illnesses. They can become chronic. You can develop, in the case of rheumatic heart disease, you can develop arrhythmias, you can develop heart valve issues, and it can really compromise function. So the concern here with strep is that it be treated aggressively and quickly so that you're not susceptible to some of those downstream consequences of an untreated strep infection.
A little footnote there. Some of you may know that you have a genetic marker called secretor status. There are two types of markers. There's a secretor and a non-secretor. It is a gene on chromosome number 9 that predisposes to you resistance to streptococcus. If you're a non-secretor, you don't have that natural resistance. And so it's very serious to be able to treat streptococcus if you don't know your secretor status as if you were a non-secretor. Because these submandibular glands, these tonsils, are the gateway to the rest of the body. And if strep descends past the tonsils, then you are very vulnerable to bacterial infection of the organs, including the heart and the kidneys. A secretor has a natural resistance to streptococcus. It will just stop right there, usually at the throat. But if you don't know, then you have to treat it as a non-secretor and be very aggressive.
Are most people secretors or
Yes,
non-secretors?
most people are secretors. About
So most people have that
85%
card.
of the people are secretors.
And you mentioned the word rheumatic, but you used something else following that. Is that the same as rheumatic fever?
Yes.
Okay.
Scarlet fever, rheumatic
Okay.
fever, same. So really, you know, one of the distinguishing features with a sore throat is going to be, is this strep? And while there's no surefire way to determine if it's strep, other than getting a test, a culture, at a physician's office, there is a set of symptoms that can predict with a decent reliability the chances that strep is present. And even when you go in and get the culture, you could just be a strep carrier. It could come up positive and you don't have strep. So there's no perfect way to understand if it's actually a strep infection. But I list 4 symptoms out that are almost always present if it is a strep infection. And those 4 symptoms are a tonsillar exudate, meaning exudate on the tonsils, some pus on the tonsils, the absence of a cough. So if it's a sore throat with a cough, much less likely to be strep. The swelling of cervical lymph nodes, both sides usually, is going to be there with strep. And then a pretty high fever is going to be happening too, because the immune system is really going to be reacting to this bacterial infection.
And the exudate is usually whitish and large, whereas staph is speckled, it's like a shotgun look on the tonsil. It's just riddled, whereas strep is large.
Like a baby size?
Even smaller. It's just,
Okay.
it's just like a little speckle of exudate.
The large, when it's large, what does large mean?
Strep.
Yeah, I know, but is it, what's it?
Okay.
Is large, what size? Like, is it gonna be
It looks like a globule
a glob? Okay.
on the back of the throat
Okay.
or the tonsil.
Yeah.
What if you don't have tonsils? Is it going to
Yeah.
be in that area?
It'll be in the
Yeah.
postpharyngeal area.
Yeah.
So,
right?
Back of
so
the
you
throat.
will still see exudate in that area.
You might see it on the uvula, you might see it on the back of the throat.
Right, right. And this is gonna be something where your throat is incredibly sore, it's gonna come on pretty quickly. And so, you know, this is a case where it's appropriate to treat this homeopathically at the outset, because it takes a few days for these downstream consequences of descending down into the vital organs to happen. So it would be appropriate to use homeopathic care at the initial stage of a strep infection, along with all the other measures of therapeutics. But if there is not resolution or improvement pretty quickly, that's a case where you want a referral to a physician to have it examined and treated either with botanicals, another homeopathic prescription, or in a very, very, very rare case, an antibiotic, which we hardly ever needed to use.
Or if you just want to be sure, go right ahead and do a quick strep test or get a culture while you're going ahead and treating it. You still have the option to treat it any way you want, but if you want to know right away, then don't hesitate.
If you know there's strep in your house and you have a strep no-sode, do you recommend dosing everybody with the no-sode? Does it work
Not
that way?
necessarily.
It doesn't work that way? Okay.
Well, if it was a chronic, prevalent predisposition going on as a contagion, then we would consider it, but I would do the consultation.
Okay.
And I wouldn't want you to be making that decision.
Okay.
Do you guys do the strep?
Quick strep?
culture?
Yeah.
Yeah.
So there's a couple of other conditions I just want to briefly touch on, because these are serious things that require a real urgent referral, and that is typically in a bacterial pharyngitis or sore throat, there can progress to the stage in which there is actually ulceration and swelling so much of the tonsils that you get into a condition which is called peritonsillar abscess. It's essentially an infection that is now invading deeper layers of the tissue and has the risk of becoming a systemic blood-borne infection. This is a very serious condition. It can, if not treated appropriately, cause what's called sepsis or bacterial infection throughout the bloodstream. And then you're looking at a really serious inpatient setting in a hospital where potentially IV antibiotics might be necessary. So if that were to be the case, some of the symptoms you'd be looking for is the patient would have a very difficult time opening their mouth. If you were able to see the throat, the tonsil would be so swollen it would actually be pushing over the uvula. There would be maybe even drooling happen. The patient might not be able to talk very well because of the amount of pain they're in. And they would feel very, very wretched. There would be a lot of discharge.
Yeah, they may have a condition that once was called quinsy,
Right.
where it's really difficult to actually breathe. The respiratory passage is being blocked off. In most of those cases, it's pretty chronic. It's been happening a long time, reports of bills like that. Dr. Hunter is making the main point, which is usually streptococcus is coming on pretty intensely and pretty rapidly. There isn't much wonderment and lingering about it. It's pretty intense, comes on strong.
So, that being said, those are the big red flags. One other condition, diphtheria, which is very, very rare, but it's a bacterial infection. The keynote for diphtheria is there's kind of a bluish white membrane that develops across the back of the throat. And this is a serious bacterial infection, can close off the airway, it can need really acute, intense treatment. And again, so the keynote there would be if there's a membrane developing across the back of the throat. It's kind of whitish blue.
Back up just a hair.
Yeah.
Under red flags, it says in children. So if children have any of those four things, that's a red flag and they need to be.
Well, it typically happens in children most commonly. I
Right.
think that's why.
Yeah, you're not gonna see this too much in
Right.
an adult.
So if it's in a child, much more likely to be strep than if it's an adult with this set of symptoms.
Right, but those symptoms, the exudate, the absent cough, they're under red flags in which not to treat, to seek a healthcare provider. Is that what you mean?
No.
No,
Okay.
no, we were saying
Okay.
that if treatment does not respond quickly,
Got it.
homeopathically and naturopathically on your own,
Got it.
to seek healthcare advice within 24 hours to make sure it starts to be treated, to prevent those downstream consequences with the kidneys and the heart.
It's gonna be up to you to determine your tolerance level for how long you're gonna wait.
Mhm.
I mean, when in doubt, give a call.
Right.
You know,
Right.
don't,
Right.
we're not trying to do this class so that, to put you at arm's length at all. It's quite the opposite, actually. We want to just empower you to be able to take some first steps. It might happen in the middle of the night, and you can reach for the remedy and maybe be better by morning.
Right.
My name is Heather.
Hi, Heather.
I'm sorry I missed last week, but I wanted to say that when I was 7, I think I had scarlet fever, and I had like, I guess I had a series of strep throat, like it kept coming back, like maybe I had it chronically, and doctors said, my mom was actually a doctor, but she was consulting with other people because I was so young and I was her daughter, and she was freaked out. And she kept putting me in, I had 104 fever for like 4 days straight. She was dropping me in these tubs of ice water, and it was like really, really painful, but she broke my fever by doing that. But I remember that. Yeah.
Yeah, it can be very intense.
Yeah.
So I want to do a quick review before we get into the remedies of what's some basic supportive things you can do with a sore throat or with when we talk about coughs. Same kind of picture of therapies that you can all do at home easily that require simply good nutrition, good rest, and use of water therapies.
And these are not in lieu of a remedy.
Right.
You could be doing these simultaneously because these will
Correct.
not interfere with the remedy.
Right, correct. And so I make a note in this first sentence to say, if it is a sore throat that hasn't really individualized as the symptoms we're gonna describe for each remedy, if it's just a bland, I have a sore throat, kind of some difficulty swallowing, but it's a very generalized thing, that's not the appropriate time to use a homeopathic remedy. The symptoms have not delineated themselves clearly enough yet. So this is the perfect time to just start doing supportive naturopathic therapies. And so I start with diet. That's a really key thing. We want to rest the digestive tract in general during an acute infection because we want to have all the body's attention on fighting the infection. So we don't want to spend a huge amount of time digesting heavy foods, which take huge amounts of energy requirements. So I will typically recommend a vegetable broth as the only nutrition for the first 24 hours of an acute illness. Very simple vegetable broth, warm broth with some salt and some other spices, and that be really the major nutrition happening. Liquids wise, lots and lots of water, keep the really tissues perfused. We want the water to help make the immune system more active. You can sprinkle a little honey and lemon in that and do a warm honey and lemon tea, which will really soothe the throat for a lot of people, kind of just make it feel a little calmer, a little more relaxed. And that's really what we would do dietarily. Adjunctively, sometimes a saltwater gargle can be really nice. A glass of water with about 1/4 teaspoon salt, just gargled, can be very helpful. A slippery elm lozenge, which is a botanical that's very coating to the throat, can again soothe that sore raw throat. It's called Thayer's slippery elm lozenge. They have them here at Pilgrim's. Very easy to get. A couple of nutrients that I recommend just generally. These are very nice broad spectrum immune support. Are vitamin C and zinc, which you're all pretty familiar with, I'm sure. I give some dosages and how to take it. These are just going to, again, enhance immunity to maybe help the immune system a little better move past that virus and push it out. And the last couple of treatments I recommend here are hydrotherapy treatments. Yeah, go ahead.
I'm assuming this dosage is for an adult, or is it?
I think
across
this
the
would be a
board?
safe dosage for children too.
Okay.
Do you see the issue with?
No.
No, yeah.
Bowel tolerance for the
Yeah,
vitamin
it's,
C.
the vitamin C is essentially to bowel tolerance. As long as the bowels aren't getting loose and runny, then you can keep doing the vitamin C on a pretty regular basis. It's water soluble, so that's why you don't give a bunch of it. You give little bits throughout the day. The last couple of treatments, which are very, very effective, are hydrotherapy modalities. And this is the use of water applications to the surfaces of the skin to enhance immunity. The first one is called warming socks. This is especially helpful with children. Popping on some wet cotton socks wrung out and then covering them with wool socks and sending them to bed. It will really increase circulation and it will pull congestion out of the head and out of the throat. Yeah.
When you're wetting that sock, is it with hot water?
Cold water.
Cold water. Okay.
Right, you want the body to warm back up the tissue and dry out the sock.
So if the child, for example, has a fever, all the congestion's in the head, throat is swollen, you want to make sure the feet are warm first. If they're not, warm them up. Then put on the thin cotton socks wrung out of cold water, and then pull dry wool socks over them. Physiologically, the body wants to warm up the cold socks, so all the blood descends to the feet. Comfort suddenly arrives, and usually sleep.
I learned about warming socks 15 years ago from Cortland Healing Arts, and my kids love warming socks. I read them their bedtime stories while their feet are in the tub, and we'd say, "Ready, steady, go!" And he runs into bed after I put his socks on, and they sleep, and their colds, the length of the cold is shortened tremendously. Warming socks are phenomenal.
They are, yeah. You can also use them for hysteria,
And
when
works
your
for grown-ups,
child is
too.
freaking out and won't stop crying. It is going to congest, the blood is gonna congest the head, and the warming socks will alter that very quickly.
My mom always used to soak the socks in apple cider vinegar.
Well,
Well,
yeah, similar thing, but it's the temperature that's really doing the work, yeah.
Yeah. And so the last hydrotherapy treatment is a little more directed at the throat. It's using the exact same principles, but it's called a warming throat compress, and that's using a cold washcloth, wringing it out and putting it over just the front of the throat, not the entire neck, but the front of the throat. And then insulating that with a wool scarf and leaving it on the throat for about an hour. And the idea here is that we are bringing the immune system where it needs to go, where the infection is really setting up. So if it's a pharyngitis, great thing to do a warming throat compress a couple times a day to really help target the immune system on those tissues.
There are many other therapies to do, but these are fundamental things that you can grab pretty quickly and do at home.
Right. And then, of course, the last note is rest, right? Our body needs time to recover, to give energy to the immune system to fight the infection, so sleep a lot and take it easy, don't go to work.
Yep. You know, you've heard scarlet fever, fever cold. In both cases, whenever there's an acute ailment like that, best to just back off the food and do fluids. Because all of a sudden now, the body's going, okay, we've got a job to do here. And if it's got two jobs to do, like digest food and try to mount a white blood cell response to this site, it's just gonna compromise everything. So do something very simple, stick with fluids, and let food go away for a while.
It's funny, you read my mind, I was wanting to ask you that. My question was, is bacterial infection usually what presents a fever and viral not?
We
Okay.
can either,
And the reason I was asking is because I've always followed that, fetal fever, or start of fever, fetal cold, and I was wondering, viral infections usually last longer, and I do a lot of detoxing. If, you know, my kids are sick, we'll do an enema, or, you know, only eat bone broth, or, you know, rest a lot and all that stuff. And so I was like thinking, oh, I wonder what the purpose of that saying was, why you would feed a fever and starve a cold. And I'm thinking, okay, well, because sometimes we can have a cold.
you know, when there's a fever, it's, the immune system is more intensely fighting.
So I thought maybe
Yeah.
the wisdom behind that would be that
Yeah.
you're really trying to detoxify
Yeah.
as quickly as possible. But it's always worked. Anytime I've had a cold coming on, whether stress or, you know, whatever it is, if I fast or
Yes, it's
just
back.
drink water, it goes away within
It will.
24 to 36 hours. Everything.
It just
Sometimes I'm
becomes-
stubborn though, and it's like, no, I really want to eat food, and I
Yeah.
really don't care, and then it'll last like a week and a half.
Yeah.
And it has to really be on the onset too. I mean,
Yeah.
right when it happens, if you are really good, it'll go right away.
And I would just say starve an illness and just get rid of the
Yeah.
cold part.
And that's kind of what I do anyways. I've always
Yeah.
wondered what that.
And
what I do from-
most of the time, those things happen because of what you've been doing with food.
Yeah.
So,
Well, and the funny thing is, the more we pay attention to our bodies, the more you'll realize that you're not actually hungry, no matter what the illness is.
yeah,
You really are not hungry. Your body just does the work.
especially if
You're
you
like,
have a fever, your body's not gonna be interested.
well, yeah.
So next what we're gonna do is we're gonna start talking about the remedies, the homeopathic medicines that are most commonly used in the condition of sore throat. This is not an exhaustive list by any means. The reason we are choosing these remedies are that they are very commonly seen remedies that come up a lot in sore throats, in pharyngitis. And there are many other remedies, if the symptom picture fits, that may be more appropriate. But because we only have so many remedies we can teach, and we're trying to give you the best tools with a limited amount of time, these are kind of the top choices. And you'll also find that these remedies, like all homeopathic remedies, have many uses. So as we teach these remedies, you're gonna see information that are not just related to sore throat, because it's gonna come back in with other conditions we're gonna be teaching that also can fit the remedy picture. So we'll go over that as we move through things. But what we're gonna kind of do is teach the remedies according to the chart diagram that we went over at the first class, learning how to create those legs to the stool, and we'll go over each type of presentation you can see with each remedy. And again, I'd ask that maybe at the end of each remedy that we ask questions so that we can make sure to get through the material.
I had a thought.
Yeah.
What if we went through each of the conditions and then went through all the remedies?
Yeah, we can do that.
Because there's gonna be so much overlap.
Right.
Uh, So if we just went through all the conditions and then we just focus on all the remedies.
Sure. Yeah.
Let's try that.
Yeah, I mean, I think the cough one is gonna be much quicker, because really, we've talked about some of the major principles treatment-wise. Thing about cough is, usually cough is not the only symptom in a condition, right? It's typically, the cough presents as part of a larger symptom complex. So cough can be a major component of asthma, pneumonia, pertussis, croup, influenza, sinusitis, allergy, and upper respiratory infections, bronchitis, pharyngitis. So these are some of the major places we might see a cough attached. The more chronic ones we'd see is in asthma or allergies or gastroesophageal reflux, so where a chronic cough might develop.
Does everybody have this?
No.
Are you on the cough and croup overview, is that where you are?
Cough and croup overview.
Okay.
Yeah.
Okay,
It's a few pages past because I have the remedies for sore throat listed first. It's about 7 pages.
Found it? Okay, we're just changing the agenda this week. We thought, talk about the ailments and then we'll go all through the remedies.
Right. So in terms of the symptoms of a cough, there's a lot of ways to characterize it. We're going to talk about those ways to characterize it as we go into the remedies. But you want to be very good about knowing the type of cough. Is it hacking or spasmodic or barking? What sensations come with it? Is it burning? Is it raw? Is it tickling? The activities that you can do to change it. Is it worse with exertion, worse with lying, worse with motion? Same thing with position. Does weather affect it? Does emotions affect it? Do different foods affect it? Are there other associated illnesses? We're going to talk about all these things when we go over the remedies, but these are the types of things you want to look to in characterizing that cough. It's not just, is it a cough? Well, how would you describe a cough?
Dr. Hunter pointed out earlier that sometimes a sore throat is so generic, you don't have much individual specific modalities identified. Because coughs usually are secondary to an illness, by the time you reach a cough, it's already starting to individualize, and so it starts to have characteristics that really help identify the remedy.
And the key thing there is that if a homeopathic prescription is really needed, there's going to be a very clear symptom picture emerging. There's going to be very specific modalities, very specific descriptors that you're going to be able to elicit. That's going to kind of point to, okay, this is an appropriate time to utilize a homeopathic remedy. Okay. Red flags, things you need to be careful for. So again, chronic coughs are more things that really require more thorough investigation and usually a referral. So chronic cough being something that lasts more than 2 or 3 weeks. We need to look at things like, is there a potential for pneumonia developing? Is there asthma, which often has an associated cough? Is there a chronic acid reflux that's disguised but is manifesting with a chronic cough? These are things that are underlying systemic conditions that can have significant consequences that really should warrant a visit to a physician to assess what's going on.
Locally here we have a chronic cough that can happen in our community because of the mutant strains of whooping cough. And so it doesn't sound or even look like classical whooping cough. It doesn't have that whoop to it, but it's a chronic cough that is related to the sequelae of pertussis. Those are long-lasting coughs, and you usually don't hear about it until somebody says, my kids just don't stop coughing, and it's been going on for 3 weeks, and nothing's helping. Unfortunately, it's well established, so.
Right. So the other piece to really think about with coughs is the more serious presentation of an infectious cough are going to be something like croup or something like whooping cough, like Dr. Todd just mentioned, or pertussis is the name of the illness. In both conditions, there's a much more severe, forceful cough, and it comes in waves. So the real concern with these conditions, not that they need a referral immediately on the onset of symptoms, but they can come to the point where there's a very big potential to compromise breathing and airway. So, for example, in croup, the airway can actually begin to swell up so much to the point where breathing, the ability to breathe becomes compromised. So there's a term called stridor, or a whistling sound. And when a child has a really bad croup, you can actually get to the point where the airway swells so much that they cannot breathe, and you'll hear a characteristic whistling stridor noise that is a sign that this is very serious. It needs to get a referral to an urgent care or a medical provider. And often accompanying this, there will be a bluishness to the face. There will be actual cyanosis because the tissues are not getting enough oxygen.
The chest will also cave in too, when they're breathing in the chest will go in.
Right, so there's gonna be really working at getting breath in because the airway is closing up.
And we don't see this very much anymore, but what we do see is false croup, which has a very strong, strange sound to it, but there isn't the serious respiratory distress. It's just a very weird cough. Sounds like a seal barking, for example.
Do adults get croup, or is it mostly?
Very rare.
Okay, I was wondering.
Yeah,
Hopefully
pretty-
not
yeah,
a
most
big-
commonly in
Mostly
children.
kids.
Yeah. So whooping cough is another serious form of infectious disease that creates a lot of coughing, mostly nighttime, and it's paroxysmal. So it comes in sets of 15, 20 coughs, and at the end of it, there's usually a whoop as the child tries to gasp in there. And with whooping cough, same types of concerns come up with closing off of the airway and cyanosis or blueness of the tissues. The child is not getting enough air, especially in very young children like infants. This can be a concern. The other concern that comes up very, very rarely is actual spread of that infectious illness into the meninges, what's called meningitis. It's actual spread of the bacterial infection into the brain. This is a very serious condition, requires urgent care. I use the term obtundation, which essentially is impaired response to the individual. They're not responsive to verbal stimulus, to physical stimulus. Those are big red flags that really mean you need to get them to a higher level of care. Yeah.
Are pertussis and croup always bacterial or always viral or either or?
Croup can be viral. It's most commonly viral.
But what about pertussis?
Pertussis is a bacteria.
It's a bacteria, but it's a strange bacteria.
Okay.
That's almost not a bacteria. It's treated in standard medicine. There isn't much of a direct target to the pertussis. They will give an antibiotic, but mostly it's to prevent a secondary infection.
Okay.
So this is where you can step in and be very effective, or get help, because there is treatment for pertussis specifically through homeopathic and naturopathic medicine. What was I gonna say there? Whooping cough, especially in our community, begins very subtly. It just begins with what looks like a cold, a little bit of sinusitis maybe, runny nose, then you get the cough. And it's not a serious cough, it's kind of mild, but it just gets worse and worse. And pretty soon it becomes paroxysmal, which there's these episodic coughs where it becomes very labored. There's a lot of labor in the cough, and it's very exhausting, and it can result in vomiting. So it can sneak up on you.
So really briefly, for management, again, the dietary recommendations would be the same as how we talked about with pharyngitis. Some of the adjunctive therapies, sometimes a humidifier can be very helpful in a cough to kind of moisten that respiratory tract and provide a little bit of ease. Conversely, for some individuals with a croupy cough, they'll do much better outside in cold air. So you could bring a child out into cold air, and sometimes that'll really help. For other children, it might be that getting in a hot shower with them is really great to help soothe those air passages.
And what are we noting here? It's like all of a sudden we're looking at modalities.
Right.
We're looking at what distinguishes one remedy from another.
So again, similar recommendations of nutrients you can use to support the immune system, the lozenges to soothe the throat and the chest with the coughing. A little bit of an alteration, instead of doing a warming throat compress, you can do the same thing with your entire upper body. You can do a t-shirt, and I've laid out a kind of protocol on how to do that, but exact same principles. You want to bring the circulation to the tissues that really need more active immune vigilance.
This is a really good replacement for mustard packs that we used to get as kids. Right. It's much easier to do, it's less messy, and very effective to do the hydrotherapy.
Any questions before we go to the remedies?
What if the cough has liquid on it? It's already, it already has, maybe it has.
Discharge with it?
Or, yeah, discharge, or just, it sounds watery, or.
Yeah, it's, again, they're looking at modalities, and we'll get into it as we go through the remedies.
Right, and another, red flag with a cough is when you have an infection that's very seriously descended into the chest, symptoms of pneumonia, which would be a fever, a rapid pulse, difficulty breathing is one of the biggest ones, a deep, deep cough that can be reflexive every time you breathe in. I mean, that's a sign that this is pretty serious and it needs to be treated.
Yeah, and so if there was a need for you to call, we would be asking a lot of questions, and we would probably ask to be able to listen to the respiration. So we're wanting to distinguish between, well, is the cough really just the result of mucus descending to the bifurcation of the respiratory tract, which happens usually when you lie down at night and you just cough it up in the morning and you're okay, versus are you producing an exudate from the lungs that it's coming up, and that's bronchitis or pneumonia. So that distinction has to be made.
What about walking pneumonia? What's the difference with what you were just saying? Is there a difference? I've heard it called walking pneumonia, or?
Walking pneumonia is used to describe pneumonia in which the patient is ambulatory, that they're not bedridden, so you still have consolidation of the lung tissues, but there's a little larger degree of functionality. It's still a serious condition that needs to be treated, but that's why they call it that. It doesn't have to do with body position per se.
It's usually taking place in a person who's already fairly compromised, so the symptoms are not as intense enough to give you the feedback that this is serious, so people kind of can tolerate it too long.
And particularly in elderly patients that don't mount as vigorous of immune response, pneumonia can go undiagnosed for months because the body's not telling us that there's an active infection going on.
I have a question kind of regarding timeline. You said in the beginning, it may not be clear. So you may have this cough that really doesn't make itself significant and you don't really know what it is, but then you talk about time going on, and then you kind of figure out through the different symptoms that are being presented after you are kind of managing it. Is that when you zero in on, do I need a homeopathic remedy? And is it the remedy that should start to show improvement very quickly? Because these management techniques, if they're going on a long time before you actually start to see specifics to narrow it down to the modality, as you're saying, that's not actually resolving within that 24-hour period. So just the timeline I'm a little confused about, if you could clarify that.
Around the strep or?
Well, just,
Any of the ailments?
yes, please, because it sounds like you're letting some things go over time before you're narrowing down specific symptoms are coming out that would point to a specific remedy.
Right, I mean, it may be that the first thing you employ are the naturopathic modalities that are trying to reverse the process. You're already on it. If you are trying to determine a homeopathic remedy, you're going to need some clues about how to know which one is right. And not until it's individualized itself enough to point those out, you're going to be guessing. And that's gonna be frustrating, because you're not gonna see anything happen, probably, unless you just guessed right, you know?
Okay.
So, that's why Dr. Hunter is pointing out there are these other things that you can be doing. You just don't have to sit and twiddle and wait for it to individualize so you can give the remedy.
Mhm.
You can be very proactive. And many times, that's all you need. You know, that's it. You don't even need a remedy.
Okay.
Yeah.
Right, it's when the body gets stuck and there's a blockage that you need the remedy to help kind of bring it back into action.
And the other nice thing about having these other choices is that if in spite of doing those therapeutic measures, it's getting worse, then you have good reason to either turn to the remedy or call,
Okay.
right?
So managing it may take more time, but once you've decided on a remedy, you should see some sort of
If-
movement toward resolution
If the
fairly
remedy
quickly.
is correct, you would see, this is a very important point, if the remedy is correct, you should see a very rapid reversal
Okay,
towards improvement,
okay,
if the remedy is correct.
okay.
The remedies are fast if they're right on.
Just real quick, if you don't mind, I have an example with arnica. I had shin split on one leg and a sprain on the other. And I would use it and I would feel the pain dissipate. And it was just kind of neat to see that, and I knew I had to do it every 2 hours. So I'd feel the pain come back on.
Doctors, I want to give you a time check. 6:20.
Thank you.
Okay.
Remedies. Aconite. Aconite, you all have aconite. Aconite is a plant. Common name, monkshood. Very poisonous. Yeah, very poisonous. Belongs to the peony family. It grows in,
The wild up in the mountains.
does on hilly areas where it's damp and shady. It's a beautiful looking plant. Mhm. Yeah, good.
Yeah, I love plant too, so.
Yeah. We use the whole plant is poisonous. In preparation of the remedy itself, all of it is used to prepare the actual remedy. So, one of the characteristics about aconite is how intense it is and how sudden it is. So you will see aconite showing up usually when the presentation is, I don't know how this happened, all of a sudden I am feeling terrible. And there's an element, because of the surprise and the intensity of it, that can induce fear. It can induce a pretty high anxiety, a sense of great caution. And everything about it is intense. So you would see aconite probably showing up in the very early stages of something that has perhaps something like strep, right? Very early. Again, we arrange this in these quadrants. So what we're looking for here, this is a reminder of a 3-legged stool. we wanna see something in each, at least 3 of those categories that is true about the ailment that you're looking at. And if it's there, then you've got a good chance that that's the right remedy.
So is that why, if you go in the wild and not knowing your plants, you eat that because of what it would do to you, then they took it and did the homeopathic.
Yeah,
And it just like the bark or,
Yes.
okay.
in other words, what we've learned from actually taking aconite from its plant source is that it produces these symptoms,
Yeah.
so that we retain that information in the preparation of the remedy, take away its biological factors, retain its energetic factors, so that then we are stimulating the immune system to respond to the symptoms.
Okay.
So, usually in a fever, if it's very high and very sudden and very intense, okay, you can see here that in the description section, that aconite is very likely a candidate. Aconite doesn't particularly have a location, it doesn't care what side this is happening on, or what part of the body. So very sudden onset, undefinable fears.
Fear of death can be very common with aconite.
Very restless, it's very hard to settle down with aconite. Very, very thirsty. Very hypersensitive to pain. It very often can come on after being exposed to really dry, cold temperatures or weather. It's usually worse at night. This is one of those, for example, the cough that's better by picking up the child and going over to the window or going outside. All of a sudden, the cough is cleared, they're not whooping anymore, or they feel better, they can breathe. You're looking at aconite maybe. They don't like to be touched, there's no pressure, pressure does not feel good. Let's say it's an ear infection, doesn't feel good, push on it. They want cold drinks. They want to be uncovered. The basic keynotes are here. So what you're looking for is at least a 3-legged stool. And it kind of it doesn't matter what that ailment is. That's why we went through all the ailments first. Kind of doesn't matter what the ailment is. What you're looking for are the keynotes. So last week we talked about sure, you can have a diagnosis of strep throat, but it doesn't tell you what remedy it is. Okay? It tells you what antibiotic to do, but it doesn't necessarily what remedy to do. So we're looking for these very specific characteristics.
Yeah.
Yeah, questions about aconite?
Can the same strep bacteria present different
Remedies.
symptoms in someone so that the remedy would be different between different
Absolutely.
people? Okay.
That's the whole point there.
Thank you.
Is that we can have the same diagnosis in 5 people and 5 different remedies.
Okay.
It's kind of the whole premise of homeopathy. Right?
Is that geared to your blood type at all?
No.
Okay.
Is it geared to the symptoms?
Yes.
Exactly.
Which can change from day to day, right? You can go from one remedy to.
It's possible, but usually that happens if there is a sequelae to it. There's other issues going on. We can talk about this a little bit. It's what can make the case confusing, because sometimes an acute issue is sort of the fountainhead of other issues behind it. This is why we have said repeatedly, and will continue to do so, that there is this intelligence to us immunologically that is trying to take care of us, trying to heal us. And it may come up as what looks like just an acute issue, but really there's more to it. And we may take the remedy for the acute and it may reveal something more behind it. Do you follow me? In which case there may be another remedy to follow. But then we're looking at a bigger picture, and what we're eventually gonna need to do is give the remedy for the bigger picture, not just the little ailments. And if it's not that, then the correct remedy should remedy the acute ailment quickly.
Now, if there's no change in the symptoms, that they just persist, that's more of a sign that the incorrect remedy was prescribed.
Yeah, in which case you'll hunt and look and be much more observant about what these characteristics are.
So suppose you tried the remedy and you're finding no resolution. How long do you wait before you try another?
How long if it's acute? Within a 24-hour period, you should see a result towards improvement. And if, depending on this is a good point, depending on the intensity of the ailment that you're trying to treat, you would want to give the remedy often. You may need to give the remedy once and look at it again in 2 to 3 or 4 hours, depending on the intensity of it. I mean, if this is a serious, can't swallow, difficult respiration, you're not gonna linger too long. You wanna see some results happen pretty darn quick.
They give it more than one shot.
Oh yeah, you may need to. But if you have repeated that remedy 2 or 3 times and there isn't anything happening,
And it's getting worse.
and it's getting worse, then you're calling or you're going on to the next remedy. Any other questions about aconite? You can see aconite being useful for things that have no physical nature to it. It could just be fear. Sometimes the element of fear is so strong that it becomes a limitation for the individual or the child. Let's say they had dental work and it was traumatic. And now they're going in for their follow-up and it's not gonna happen. They're freaking out. Aconite before the dental treatment might enable them to continue.
Sorry, one quick question. So if the symptoms of strep throat do match the aconite, you're using a 30C, and how often are you giving it until you're seeing improvement? Every half hour
It's-
or?
Not necessarily. I would say probably, again, it depends on the degree of intensity. 2 hours, every 2 hours?
Every 2 hours?
Mhm. It's a basic rule of thumb if it's intense.
And aconite and belladonna, which I'm about to talk about, are typically very intense remedies. So they're gonna come on very strongly. The individual's gonna be reacting very strongly in a symptom picture. That corresponds to a higher frequency of prescribing and would expect a quicker resolution as a result as well.
Do you have any negative effects from taking the wrong remedy? I'm just curious, like
These are
the-
30Cs, so there's
okay.
no,
Just curious, like the tree bark analogy.
no.
you know,
The analogy
flies.
is shooting an arrow at a target. If the arrow misses, there's not gonna be anything happening. If you hit the target, there's gonna be an effect that you'll notice.
And these are all really great questions about case management and very important. So, we'll come back to this a lot throughout the class with every remedy we cover. So don't feel like you have to get it all figured out right here, right now. We'll keep going over case taking, prescribing, how to follow the case, all of that. So belladonna, a very excellent remedy, many, many uses. Belladonna is also a plant. The plant substance the homeopathic preparation is derived from is from the deadly nightshade family. It's a very beautiful plant with a drooping kind of purplish flower. Very, very toxic and poisonous also. It is in the medical world called a parasympathetolytic, meaning it blocks the parasympathetic nervous system. There are many results of this. Racing heart rate is one of them. Sweating is another, and these are just physiological effects noted in the medical community. Pupil dilation is another one. And consequently, when we observe the homeopathic indications for belladonna, we see many of these indications comes up. Belladonna, the word means beautiful woman. I'm forgetting which language that is in, but it's Spanish. Italian, okay. But the reason for that is that the beauty trait associated with big, huge pupils, which is one of the keynote symptoms of this remedy, belladonna.
And rosy cheeks.
And rosy cheeks, right. The redness and is a big common symptom of that parasympathetolytic type of action of the toxic compounds in belladonna. So it's very good to talk about belladonna right after aconite because many of the symptoms are overlapping in these two remedies. They both come on very quickly. They're very sudden. There is an intense onset to them. Both of them have very high fevers often associated with them. Aconite is usually a little bit of a higher fever, but both can have very high 102, 103 degree fevers, very common with these remedies. There's a huge number of conditions in which belladonna can be used, anywhere from fevers to headaches to sore throats, earaches, coughs, abscesses, delirium, lots of places where we see belladonna as a very helpful remedy. Some homeopaths would consider it probably the one indispensable remedy in the whole materia medica that they wouldn't want to do without. So this remedy comes up a lot. One of the big keynotes of belladonna is congestion is a huge leading symptom of this remedy. Congestion that localizes to a tissue. So Dr. Todd was talking about aconite and that it doesn't really localize, it's very much more generalized. In belladonna, we'll actually have congestion localizing. Most commonly to the head, you're almost always going to see prominent head congestion symptoms happening in the remedy, but it can be a throbbing finger, or it can be congestion localizing to the eardrum, or it can be congestion localizing to the throat, as in pharyngitis, to the head. Very common coming with the congestion is redness. It's going to be very bright red. The tongue can be bright red. The back of the throat can be bright red. The eardrum can be bright red. So bright red, very hot. I mean, you can feel the heat coming off of it often. It's hot, it's red, it's swollen, it's congested. Important distinction to make with belladonna is it's also going to be dry. So you might see a lot of heat with it, a lot of redness, but there's not going to be any exudate. There's not going to be a lot of sweating off of the tissue. It's going to be a dry heat. And a big distinction for both belladonna and aconite is these are very early stage remedies. They're going to be right at the onset of an illness that you're really going to see belladonna and aconite come into play. If you have discharge, for example, off the tonsils, like exudate, if you have what's called suppuration or any sort of fluids discharging from the affected tissue, not likely at all to be belladonna or aconite. These are at the initial onset before there's any discharge happening is where you're going to see these remedies.
Belladonna historically has been used almost as a specific for streptococcus. It was first used in 1799, 1800 for the cholera epidemic. Hahnemann employed belladonna to treat cholera. So it's been around a long time. And the description that Dr. Hunter just gave is what happens when you are poisoned by belladonna. So when you take belladonna, you're not going to get poisoned. It's going to do the reverse.
No, those purple flowers turn into red berries.
Yeah, they're like,
And
they're called small
beautiful.
cherries.
Yes.
They're black.
And they, red, right, they turn, yeah. So kids can easily mistake them,
For
like currant
choke cherries.
or something, yeah.
Yeah, they are very alluring.
Yeah.
They're very alluring.
Satisfying.
Yeah.
So some of the other things about belladonna that are important to know about is that the patient is gonna show a lot of restlessness. They're gonna be moving, they're gonna be kind of uncomfortable in their skin with this. But at the same time, a lot of motion or a lot of jarring is not gonna feel nice. They're not gonna want to have, like with aconite, have you touching things. They're not gonna wanna be jarred. They're not gonna wanna move a lot. They're gonna wanna be pretty sedentary. They're gonna wanna just kind of be not messed with.
In fact, if you do, they get mad.
Right, and there might even be to the point, Dr. Todd was talking about, you know, kids getting hysterical and going to the head. Well, that's classic belladonna, right? There's actually to the point where the congestion and the kind of intense nature of it, the patient can display a sort of delirium. They can become delirious. They can be have delusions about things. They're seeing fearful things that, you know, monsters, whatever that might be. They're, you know, what I mean by delirium or deliriousness.
So our challenge is gonna be distinguishing between aconite and belladonna, because there's likenesses there, right? They're both works at night, come on suddenly, it's both really intense. So you're gonna have to look close.
Right. One of the differentiating ones, again, is the motion is a big difference. The delirium is gonna be something that's more prominent in belladonna. Localization is a big part of it, the keynote there, that it's gonna localize to a tissue, more often to the right side. So if it's a right-sided sore throat, you can think more about belladonna. They're gonna be worse with putting heat on it. They're gonna be worse with light, with noise, with any stimulus they're gonna be bothered by. And it's gonna be very painful, like in aconite, they're very sensitive to pain. The flushed face, the glassy eyes, the pupil dilated, that whole symptom picture of what it is like getting an overdose of belladonna, those are classic concomitant descriptors to lead you to a belladonna prescription. The individual, along with the restlessness, can actually get spastic. They can jerk and twitch. Another very common keynote that is a very big tip-off for belladonna is the head can be very hot and congested, but the extremities very cold. An example of a belladonna sore throat would be a very painful, bright red, dry sore throat with red, swollen tonsils. A sense of constriction, of dryness, and a desire to swallow. That'd be very common for a belladonna sore throat.
One of the distinctions that I make between other remedies in belladonna is that when a kid has a fever, or they're having the sore throat or the headache or whatever it is, the belladonna kid is not taken down by the fever. They're very active. They're very normal in many respects. They want to play still. They're not lethargic, and they don't have this fear factor. If they're anything emotional, they're angry, they're upset, they're mad. They have very low tolerance levels, very impatient, but it's not fear. And they do very well. Whereas aconite, for example, is easily taken down. They're going to be really affected by a fever. Emotionally, they're distraught. Whereas the belladonna is, I'm fine, you know, and they're playing, but their fever is 103.
And another differentiating point between the two is a very, very prominent part of the etiology or cause of an aconite illness is the exposure to cold and cold wind. So if that precedes it and it was, wow, everything was great until I went out on that cold, chilly autumn day, and then all of a sudden this happened, that's a big causative factor in aconite illness, whereas belladonna, that's much less likely to be an issue. They're gonna be pretty hot and there's not gonna be a cause so much.
Or an ailment from a fright
Right,
would be happening.
right, exactly. A couple of other really prominent things with belladonna is, a keynote is that oftentimes the symptoms get worse into the afternoon and the evening, worse after 3 p.m. is one of the main modalities here. And they can often do better standing or sitting up is another one. I think that really covers the main broad points of it, of what belladonna illnesses look like. Very subtle.
So even though they're really hot, they want to be covered. I see it better with covering, like with you.
Yes,
Flush,
for a
but they
little
want to be
while.
under the covers.
For a little while.
Okay, yeah.
Right.
It's not like they're hot, stripping off everything and, okay.
Yeah.
Just interesting, belladonna has two, what I would call sinister sisters. Henbane and Datura stramonium. They're related in the same family. They're not as evil and as poisonous as
Which one did you, was the first
belladonna.
one you said?
Henbane and Datura.
H-A-N-E?
Henbane.
Okay.
Henbane. We're gonna have to kind of pick up our pace a little bit. Pepper salt. Pepper salt is not a plant. It's a combination of sulfur flour and calcium sulfate. Hahnemann introduced this long ago. It's a very interesting chemistry, and it has very interesting characteristics. One of the most outstanding characteristics is that they're very cold. When they have a fever, they cannot get warm. It's shivering, trembling cold. Whereas the aconite and the belladonna are too hot.
That's a descriptor.
It's a big, you're gonna see it throughout Hepar, if there's a fever.
It's in the concomitant section, very chilly.
Oh.
One of the number one chili remedy of all the remedies. Very chili.
So you can use this for many different conditions. You can see them listed under conditions there. There's going to be usually a lot of discharge with Hepar sulf. Rattly cough, you can hear the wetness. It's loose, it's wheezy. The pains are intense, sharp. You don't see usually Hepar sulf in the very early stages of one of these illnesses. You'll see it come on as it becomes more mature. So once the discharges start to form, you're going to probably be looking at Hepar sulf as one of the conditions, one of the remedies. So that's when you see mucus start to show up. It's also, of course, going to be worse with added cold. Go there. They don't like the pressure. It's very common to see it show up in the wintertime. They love warmth. They want warm drinks. They want to be wrapped up.
Covering up the head is a big, covered up inside, bundled up.
And they sweat a lot. They perspire, even though they're cold. Very interesting keynote there.
One of the big symptoms with Hepar is that they're incredibly sensitive to pain, one of the most sensitive to pain remedies there are. So there are going to be a lot of suffering. They're going to say, I just can't stand this. My throat hurts so badly. The pain is just unbearable. The suffering, they're very fixated on the suffering component of what's going on.
Okay, let's do that.
Sure.
Where's the intense suffering go? Which quadrant?
It's under concomitants.
Okay.
Right. So lycopodium is a pretty quick one. This is a very common remedy used for many conditions. It's also a very common remedy used for a constitutional, but we'll see it in a lot of different places. It's a club moss. It comes from the club moss, an ancient moss species. And we'll see lycopodium come into play more prominently with digestive symptoms. We're going to come back to it when we do our digestion week. It's going to come up a lot with gas and bloating, some diarrhea, has a real affinity to the alimentary tract or the digestive tract in the liver and the genitourinary tract. So we'll see it in a few places there. Some keynotes of a lycopodium type of person. In terms of appearance, if you were to look at someone and think lycopodium, they have a very the structure goes very large from the head and kind of shrivels up as it goes downward. So large, intelligent head and shriveled up musculature. They're chilly people. They crave sweets a lot, oftentimes. They have a big appetite, but they get satisfied very easily. And they're typically very irritable, type of easily angered, haughty, or they get bothered and irritated a lot. That's kind of a lycopodium disposition. In terms of sore throats, the biggest symptom guiding you to lycopodium, besides those concomitants I talked to you about the lycopodium picture of a person, is going to be that it's going to be a right-sided, very prominently right-sided sore throat. Sometimes that can move to the left, but it's going to present right-sided. Another big modality or causation piece is that they're very aggravated in the late afternoon, early evening from 4 to 8 p.m. And they don't do very well with colds. So they don't like cold drinks. They really like warm drinks. As a contrast, they actually do a little better in cool open air and get aggravated in stuffy rooms. And they're pretty cranky in the morning, so their symptoms are going to be worse in the morning when it's lycopodium. The sore throat's going to be a lot worse in the morning rather than later in the day.
And just one of the leading things is this digestive component. I mean, there'll be something about that. Either the severe craving for sweets or the fact that, they try to eat and they are suddenly full. There's going to be something about lycopodium that relates to the digestive system. Because it's a very strong liver remedy. Mercury. Again, not a plant, a chemical. Mercury was used back in heroic medicine days for the treatment of syphilis. There are different kinds of mercury. This is Merc Viv or Merc Solubus. Mercury can be very handy in your kit. It is a very strong remedy that has similarities to belladonna.
Is there more than one Merc? Because I see Merc C and then I see.
Yes, there are many Mercs. There's Merc Viv, Merc corrosivus, Merc solubus, Merc Viv, Merc iotum. Yeah. But this is the one that covers most of the common ailments that we're going to see. So you can see the conditions that it's often used for. What's interesting, distinction between mercury and belladonna, for example, is that belladonna's got a high fever, if it's her fever. Belladonna has a real low-grade fever. And it has a lot of lethargy, very tired. Whereas belladonna is bouncy and still feels pretty good even though they're very sick. Mercury has a really strong thirst and a lot of salivation. And very sweaty, clammy. Mercury can be used for lots of conditions. Again, we didn't list some, but a very common one that is very chronic is for Crohn's disease. Because the mucous membranes are its affinity. So we use it for ear infections, we use it for sinusitis, we use it for sore throats. It just happens that the colon is a mucous membrane, so it certainly would pertain to that. The concomitants, I mean, there's a lot of them there. I've mentioned a few of them. The perspiration is excessive, they're very thirsty, they tend to be chilly, their pains are fairly intense. They're also worse at night, just like a lot of these other remedies.
And interesting, mercury, someone with a mercury illness is going to be, it's going to be they're really sick. Like there's going to be suppuration of tissue. There's going to be discharge. It's not like one of those just run-of-the-mill, oh, we don't need homeopathy for this. I mean, the pathology is pretty significant. There's really bad smells associated with mercury, like the breath will be very, very foul and strong odor to it.
Yeah, and again, like Hep itself, it doesn't show up right away. It's one of these illnesses where it's gone on long enough that it's matured into quite a mucousy, highly developed discharge.
And it can be green, it can be bloody, there can actually be blood in the discharge, there can be ulceration. It's we call syphilitic remedy, so there's a lot of destruction happening of these mucous membranes and tissues.
Very, very strong affinity for mucous membranes, and it can do big damage. So, if you've ever studied what syphilis looks like, it is a very ulcerative disease. It can damage all the mucous membranes, including necrosis of the nose and facial bones. It'll eat you up. It's hideous. And that's kind of why it was used in heroic days, but it was used as mercury. But Hahnemann used it as a homeopathic remedy and did much better.
What did you say about the fever part? I'm sorry.
Very low grade fever. It doesn't usually go above 101. Whereas belladonna, aconites can be like way over 101.
Like you said, a big differentiating point with something like belladonna is that this person's going to be lethargic. They're going to be, they can be very confused. That's a big keynote for mercury, that they're confused, out of it, a lot of fogginess. Think about mercury when you see that.
Spongia?
Yeah, this is a quick one too, spongia. Now, this one can happen with sore throats sometimes. You sometimes will see a spongia sore throat, but the big place we really think of spongia is in a croupy cough. There's a very particular nature to a spongia croup that kind of gives away its characteristic, which is that it's called an old term is sibilant, but it's like, the description is like a wood saw driven through a pine board. If you know that, so it's a piercing, shrill cough, and it's dry and it's barking, very hollow.
It's the strangest bark.
Yeah.
You'll know it when you hear it, right?
And it's like we talked about with croup and pertussis, that it can almost be suffocated, so it's going to come in bursts and very exhausting, and there might be some cyanosis or blueness of the face associated with it, and the person will become very hoarse often. Their voice will go away and get really hoarse. There are some particular modalities here. None of these are incredibly distinguishing, as in you're really looking for one, but it's worse with cold, dry winds. Exertion makes it worse. Movement makes it worse. In nighttime, especially around midnight, it's particularly comes on, which croupy types of coughs are obviously mostly worse at nighttime, so that's part of that picture. Better with warm food and drinks. Really strong affinity to the respiratory tract with this remedy. It's not used for a lot of conditions, but very strong with the respiratory tract and heart.
Think of it this way, it's marine sponge from the ocean, and historically it was used to help treat thyroid because of the iodine component in it. So it has an affinity for this part of the body right here, and that's where that very stridus, barky cough is coming from. It's a little bit lower down. That's why it sounds so weird. And you feel it here when if you've ever experienced that barky cough before. It isn't up here in the postnasal pharynx, it's here. It's very guttural.
And the other descriptor, I use the saw sawing through pine wood. The other way people call it is a seal bark cough. So if you can appreciate what a seal bark is like, that's a spongia cough.
Yep.
But also, like if you were to call a pediatrician and say they're barking, it's like a seal, it's a bark, they're gonna think pertussis, they're gonna make you come
Yeah.
in and draw that thing up through their nose, and, you know, so that's
Yeah.
a caution that it's not necessarily always gonna be a pertussis
No,
cough,
not
it
at
just
all.
could be
It's usually
spongia,
not.
yeah,
Right.
right.
Yes, so Causticum, this is another remedy of many uses. It's made from a preparation of potassium hydroxide, which is, again, it's a mineral compound we're talking about here. So it's a has a very strong affinity to the neurological symptoms system, and a lot of the symptoms of it are very neurological in nature and how it presents. So something like Bell's palsy, Causticum is a really common remedy. Lots of degenerative neurological conditions, tics, spasms, MS, ALS, some of these really serious chronic degenerative neurological diseases, Causticum is a big remedy. We're going to see it come back again with urinary tract infections, with burns. Incontinence is a big common cause using Causticum. So big remedy, lots of uses. Some of the typical keynotes for Causticum, in terms of if we're talking about from the perspective of cough, which is this week's focus, is one of the biggest pieces that you know it's a really Causticum cough is that the patient complains of really great soreness or rawness. So the cough is a sore cough, it's raw. They really feel it in the chest or in the throat with the cough. That's a big part of Causticum. Some coughs are not sore at all for people, but with Causticum they really feel it. They describe a strong sense of soreness.
It's a tearing sensation and very harsh cough.
Yeah.
Very harsh, hurts.
Right. Painful, harsh, hurts. There's a lot of hoarseness, there's a lot of loss of the voice. It's usually a pretty dry cough. There'll be a sensation like there's something down there in the chest, but they just can't get it up. So they're gonna cough deeper and deeper and deeper to try to get something off, but they can't bring the mucus up. That's a pretty big keynote for Causticum.
And if they do bring up anything, it takes a lot of cough to do it, and it's usually a whitish glob of mucus. But it takes a lot of labor to get it up.
A couple of keynote modalities, some of the big prominent ones for Causticum is, unlike most remedies, they are much worse in nice weather. Sunny, nice, especially dry weather really aggravates their cough, but wet weather is much soothing for them. They actually really like being in wet. And this is for all the conditions for Causticum. They do much better in wet weather, much better in wet, warm weather, better with cold drinks. Worse when they lie down, worse when they bend forward. Some of the modalities in terms of motions that can make the cough worse. Some general things about a Causticum type person, they can be very serious and melancholy and pessimistic, critical people. They're very idealistic and they're very passionate about issues. They can have a very strong sensitivity to injustices. That's very common in a Causticum type person. These are not going to be coughs typically that come on right at the beginning. They're a little bit slower to develop.
That's a good segue to phosphorus. Phosphorus is very different from Causticum. Phosphorus is a very gentle, very affectionate, very sympathetic, tender, sweet sort of disposition. Phosphorus means light. It has an affinity for the chest, a very strong affinity. So we are including it in the pharyngitis and the coughs. It's very common in laryngitis. We didn't go into that very much, but you will see that it's very typical for phosphorus to lose their voice. Singers, bronchitis, it's an amazing remedy for pneumonia, and some neurological conditions, which you probably won't run into. It is a dry cough. It's a tickling cough. It's usually it can be painful or painless. It's worse with trying to talk or laugh and try to emit some sound. It's tends to be left-sided, and they don't like lying on the side of the cough or the sore throat. They want to be on the other side. This is a cold or a sinusitis or an illness that wants to descend. It wants to go down into the bronchioles or into the lungs. So if you start out with something and you notice right away it's wanting to descend, you may be looking at phosphorus. Again, they tend to be very sympathetic, very sweet dispositions. They love consolation.
So I'm hearing you say that a person's temperament plays a part in
Oh, absolutely.
how they're able to
Yes.
express and then the remedies that
Very
they're
much so.
going to receive.
Very strong lead.
And as we go through the course, we'll probably have a discussion about constitutional remedies and how that relates to acute prescribing. It's kind of a broader discussion, so we'll get into how those constitutional pieces relate to acute prescribing.
Phosphorus is very thirsty. They can't, and they drink in large amounts. They just don't sit.
They want cold drinks.
And they want really cold drinks. They can be restless, even though they want consolation.
We're heading into 5 after 7.
Okay.
And you have 2 more to go, so
All right.
just to let you go.
Yep, and it's not like this is the only time we're going over these. We'll be coming back to.
We'll go more detail.
They love to be massaged. They want to be rubbed. Like I said, they want consolation.
Do these remedies address any of the other issues, like, for example, in this one, the fears, or is it simply just, are we talking about like the throat and the coughing?
Right, well, those fears will dissipate when the correct remedy is prescribed. They'll feel a much better sense of well-being. So phosphorus is a very fearful remedy in the presentation, but when the correct remedy is prescribed, a lot of those symptoms will be alleviated in reverse. Right.
I mean, there's a plethora of conditions. What we're doing is just picking out very common ailments
Yeah.
that you will run into at home.
I was just trying to figure out if it was solely focusing more on the presentation of the coughing.
Right. And we'll get more into phosphorus. It's going to come up again. We'll talk more about it as a remedy. Carbo vegetabilis, which is vegetable charcoal. This is a remedy like lycopodium. We're going to see a lot of affinity towards the digestive tract. It's going to come back in a couple of places. So you'll see some conditions like flatulence, bloating, indigestion. It's also a remedy that comes up with cough, with hoarseness, and with things like hemorrhage or bleeding. One big thing about carbo vegetabilis is that a very profound weakness, collapse, debility is really going to be present in this patient. Their vitality is going to be almost non-existent. They're going to be really, really low vitality, really weak, really kind of no energy. Oftentimes you'll see this in a person who hasn't recovered well from a previous injury or disease. The person will be oftentimes pale, cyanotic. They're going to be cold with clammy sweat. And everything is going to be very weak about it. There's going to be oozing blood from the skin. It's not going to gush like it would in phosphorus. It's going to be very slow oozing. There's going to be a lot of digestive symptoms, which we're going to talk more about. The cough of carbo-veg is burning. It's in the larynx a lot. Larynx is a really prominent place for it. It's going to be worse in cold weather. And one of the big keynotes is that they're better from being fanned or better from air passing over them. That's a big symptom.
And maybe you're getting the picture, but carbo-veg has this, the person who needs carbo-veg has this great need for oxygen. They're not getting enough oxygen. That's why it's a very important remedy in these coughs that are suffocated, where it's really difficult to feel oxygenated. It's one of the prominent remedies we will use for altitude sickness, where you're hiking at a high elevation and you're starting to run out of air. Carbo-veg can rescue you. If you're going to hike to Machu Picchu, take carbo-veg with you. It's a powerful remedy for coughs that are suffocated and causing great weakness because of a lack of oxygen. I'm just gonna real quickly mention it. Last, Brionia. Again, we'll go through all these, some of these will come up, they'll overlap, so we'll go through these again. Brionia alba, the white hops. This is a remedy that could be in the early stage of an illness. It's got some very strong characteristics. It tends to be left-sided. And
It says
it-
right-sided.
yes, but it tends to be left-sided. Do we have?
Are there different kinds of bryonia? Or just one kind?
No, that's one main remedy, yeah. Yeah, it might have just been a typo.
I think it's
It's left-sided.
left. One of the major keynotes to Brionia alba is it's worse from movement and worse from pressure. So if you have a headache or a sore throat, or you have a cough and as soon as you move you cough, or as soon as you move the headache is worse, or as soon as you swallow the sore throat is intense, you may be looking at Brionia. Now you have to match it up with these other modalities. So it's worse with motion, any form of motion, whether it's rising or eating or any kind of motion. It's worse with warmth. They want to lie very, very still because they don't want to move. They want firm pressure.
Right, so paradoxically, even though they don't want to move, they actually want to lie on the
They want-
painful part or
Yeah.
have pressure over
Right,
the
they
part
want
that's
to
sensitive.
do this if they have a headache. If they're going to move, they'll hold that position so they don't make it move anymore. They like the cold air. It's a dry cough and it's a very hard cough. It's painful for them to cough because, again, movement. It's a very stitchy pain.
And part of that is from the physiology of it. All of this, it affects all of the serous membranes, but there's a dryness to all the tissues. So the rubbing of the bryonia type symptoms create these stitching pains that are very characteristic of it.
And they're very thirsty.
What's a stitching?
Like little stitches being put into your skin or into the affected tissue.
It's like a little shock.
Yeah. Kind of stabbing, but it's more of a stitch, really. Imagine your skin.
I know we went pretty quick through the remedies, but it's not like this is our only opportunity to look through the remedies because these will be overlapping a lot of the other conditions. That's kind of the beautiful thing about homeopathy is that there isn't just one ailment, one remedy.
And I think actually all the remedies we covered today, except for maybe one or two, are going to come back later in the course. So if you have more questions about the remedies, bring them to the next class and we'll be going over them.
And remember the three-legged stool. We're trying to find enough evidence of the illness as it relates to the remedy.